I'm about to reveal something that might change everything you think you know about high blood pressure. After years in operating rooms repairing hearts damaged by uncontrolled hypertension, after watching countless patients suffer strokes that could have been prevented, I've learned something critical that most doctors never tell their patients. High blood pressure isn't a life sentence. It's not something you just manage with pills forever. In many cases, it can actually be reversed, not just controlled, not just managed, actually reversed. What I'm about to share goes against the conventional approach you've probably experienced. Your doctor likely told you you'll need medication for life, that high blood pressure is just something that happens with age, that the best you can do is keep it under control with pills. But that's not the complete truth. The pharmaceutical companies certainly don't want you to know that lifestyle interventions can be as powerful, sometimes more powerful, than medications. But I've seen it happen, patient after patient, blood pressure reading after blood pressure reading, and I refuse to keep this information hidden any longer. By the end of this video, you'll understand exactly what causes high blood pressure at a cellular level, why the standard medical approach often fails, and most importantly, the specific strategies that actually work to reverse hypertension, not just mask it with medications. This isn't about willpower or deprivation. This is about understanding your body and giving it what it needs to heal. Stay with me because what you're about to learn could save you from a stroke, a heart attack, kidney failure, or dementia. This could literally add decades to your life. Before we begin, an important disclaimer. The information I'm sharing today is for educational purposes only and should not be considered medical advice. I am not your personal physician. Never stop, start, or change any blood pressure medication without first consulting with your doctor. Stopping blood pressure medication abruptly can be dangerous and potentially life-threatening. Every person's hypertension is unique, and what I discuss here may not apply to your specific circumstances. Always work with your healthcare provider to make decisions about your blood pressure management. If you have severely elevated blood pressure, you need immediate medical attention, not lifestyle changes alone. Now let me tell you about Thomas. Thomas was 64 years old when I first met him. He'd been living with high blood pressure for 15 years. 15 years of taking pills every single morning. At first, it was just one pill, then two, then three. By the time he came to see me, he was taking 3 different blood pressure medications every single day, religiously, never missing a dose. And his blood pressure was still 165/95. Thomas would wake up every morning, check his blood pressure with his home monitor, and see those numbers staring back at him. 165, 168, 172, sometimes higher. The top number, the systolic pressure, was supposed to be under 130. His was consistently in the 160s and 170s. The bottom number, the diastolic, was supposed to be under 80. His was in the 90s. He knew what those numbers meant. His father had died from a stroke at age 68. His father's blood pressure had been uncontrolled, just like his. Thomas remembered visiting his father in the hospital after the stroke. His father couldn't speak. The left side of his face drooped. His left arm hung useless at his side. His father had been a strong man, a carpenter who built houses with his own hands. And in one moment, one blood clot traveling to one part of his brain, everything he was had been erased. Thomas was terrified of ending up like his father, so he took his pills faithfully. He went to all his doctor appointments. He did everything he was told to do. And yet, his blood pressure stayed dangerously high. His doctor's solution was always the same. Add another medication. Increase the dose. Try a different pill. At his last appointment before he came to see me, his doctor had recommended adding a 4th medication. A 4th pill to add to the 3 he was already taking. But Thomas was suffering. The medications were destroying his quality of life. He was dizzy all the time, especially when he stood up too quickly. He'd get lightheaded walking upstairs. Once he almost fainted getting out of bed in the middle of the night to use the bathroom. He caught himself on the dresser before he fell, but it scared him badly. He was exhausted constantly. A fatigue that sleep didn't fix. He'd wake up tired. He'd go to bed tired. Everything felt like it required enormous effort. Playing with his grandchildren exhausted him. Working in his garden, something he'd always loved, left him depleted for hours. And his thinking wasn't sharp anymore. He'd forget words mid-sentence. He'd walk into a room and forget why he went there. He'd read the same paragraph 3 times and still not remember what it said. At 64, he felt like his mind was failing. Were these side effects from the medications? Were they symptoms of his uncontrolled blood pressure damaging his brain? He didn't know. His doctor never asked about side effects. Every appointment was the same. Check blood pressure. It's still high. Here's another prescription. See you in 3 months. Thomas came to me desperate and frightened. I'm doing everything right, he said. Why isn't this working? Why is my blood pressure still so high despite 3 medications? What am I doing wrong? I looked at his medical chart. It was thick, years of visits documented. 3 blood pressure medications, an ACE inhibitor, a calcium channel blocker, and a diuretic. A statin for cholesterol. A medication for acid reflux. But as I read through the notes, I noticed something. Nobody had ever asked him about his diet. There were no notes about what he ate. Nobody had asked about his sleep. No documentation of sleep quality or duration. Nobody had asked about stress. Nothing about his lifestyle, his habits, his daily routine. They were treating his blood pressure number. But nobody was asking why his blood pressure was high in the first place. I told Thomas something his doctors had never said. Your high blood pressure isn't the disease. It's a symptom. Your body is screaming that something is wrong. The medications are just turning down the volume on that scream. They're not fixing what's actually broken. I ordered tests that his regular doctors had never ordered. Fasting insulin levels. Inflammatory markers, including high-sensitivity C-reactive protein. Cortisol levels to assess his stress hormones. Vitamin D levels. Magnesium levels, both serum and red blood cell magnesium. A comprehensive metabolic panel to look at kidney function and electrolytes. When the results came back, the picture became crystal clear. Thomas's fasting insulin was 28 microunits per milliliter. Normal is under 5. His insulin was sky high, indicating severe insulin resistance. His body was producing massive amounts of insulin just to keep his blood sugar somewhat controlled. And that excess insulin was driving his blood pressure up through multiple mechanisms. His C-reactive protein was 4.8 milligrams per liter. Anything over 3 indicates high inflammation. His body was in a chronic state of inflammation. That inflammation was damaging his blood vessel walls, making them stiff and unable to relax properly. His cortisol was elevated. Not dangerously high, but consistently above optimal range. His body was stuck in chronic stress mode, constantly producing stress hormones that constricted his blood vessels and raised his pressure. His vitamin D was 18 nanograms per milliliter, severe deficiency. Optimal is 40 to 60. Vitamin D deficiency is strongly associated with high blood pressure, and correcting it often lowers pressure significantly. His serum magnesium looked fine, just barely in normal range, but his red blood cell magnesium was clearly deficient. Magnesium deficiency causes blood vessels to constrict and stay tight. It prevents proper relaxation. It's like trying to force blood through squeezed pipes. These weren't being addressed. These were the actual causes of Thomas's high blood pressure. The medications were trying to force his blood vessels to relax and his kidneys to excrete more fluid. But they weren't addressing why his vessels were constricted in the first place. They weren't fixing the inflammation. They weren't fixing the insulin resistance. They weren't fixing the stress response. They weren't fixing the nutrient deficiencies. Over the next 6 months, we worked systematically to address every single underlying cause. We completely changed his diet to reduce refined carbohydrates and sugar, which was driving his insulin resistance. We added specific foods rich in potassium and magnesium. We implemented stress management practices, including breathing exercises twice daily. We optimized his vitamin D levels with supplementation. We added magnesium supplementation. We addressed his sleep, which turned out to be terrible, only 5 hours per night and fragmented. The results were remarkable. Not overnight, not in a week, but consistently, progressively, his blood pressure began dropping. After 2 weeks, it was averaging 155/88. Still high, but better. After 6 weeks, 142/82. After 3 months, 132/78. After 6 months, his average blood pressure was 118/76. His doctor was stunned. His blood pressure was finally controlled, better controlled than it had ever been on 3 medications. And we were able to eliminate 2 of his 3 medications entirely and reduce the dose of the remaining one to half of what he'd been taking. But more than the numbers, Thomas felt alive again. The dizziness vanished. He had energy. He could play with his grandchildren without exhaustion. His mind was sharp again. He could remember things. He could think clearly. He told me it felt like a fog had lifted from his brain. This is what's possible when you understand what's actually causing high blood pressure and address those root causes systematically, instead of just throwing medications at the symptom. Comment below if your doctor has ever explained the root causes of your high blood pressure. Type "never explained" if this is the first time you're hearing that high blood pressure isn't the disease, it's the symptom of underlying problems. I want to see how many people have been kept in the dark about what's actually wrong. So what are those root causes? Why does blood pressure become elevated in the first place? Let me explain what's actually happening inside your body at a cellular level, because you can't fix something if you don't understand what's broken. Your blood pressure is determined by 2 main factors. First, how much blood your heart pumps out with each beat, called cardiac output. Second, how much resistance your blood vessels create to that blood flow, called peripheral vascular resistance. Blood pressure equals cardiac output times vascular resistance. That's the basic equation. When your blood vessels are flexible and relaxed, they create low resistance. Blood flows easily. Pressure stays normal. But when your vessels become stiff, narrow, and constricted, they create high resistance. Your heart has to pump much harder to push blood through those tight vessels. Pressure increases. That's basic physics. But here's the critical question nobody asks. Why do blood vessels become stiff and narrow? What makes them constrict and lose their flexibility? This is what determines whether you develop high blood pressure or not. And it happens because of 4 primary processes that modern medicine largely ignores: endothelial dysfunction, chronic inflammation, insulin resistance, and sympathetic nervous system overactivation. Let me break each of these down in detail, because understanding these mechanisms is absolutely essential to actually reversing hypertension instead of just masking it with medications. First, endothelial dysfunction. The endothelium is the thin layer of cells, just 1 cell thick, that lines the inside of all your blood vessels. Every artery, every vein, every tiny capillary is lined with these endothelial cells. They're not just passive barriers, they're metabolically active. They produce dozens of substances that regulate blood vessel function. The most important substance they produce is nitric oxide. Nitric oxide is your body's natural blood pressure regulator. It's a gas molecule, simple in structure, but incredibly powerful in effect. When endothelial cells produce nitric oxide, it diffuses into the smooth muscle cells that surround your blood vessels. Nitric oxide tells those muscle cells to relax. When they relax, your blood vessels dilate. They open up. Resistance drops. Blood flows easily. Blood pressure stays normal. Nitric oxide also prevents inflammation in your blood vessel walls. It prevents white blood cells from sticking to the endothelium and triggering inflammatory responses. It prevents platelets from clumping together to form dangerous clots. It prevents the oxidation of LDL cholesterol, which is what actually makes cholesterol dangerous. Nitric oxide is protective in every way. But when your endothelium becomes damaged, dysfunctional, it stops producing adequate nitric oxide. Production drops, sometimes drastically. Your vessels lose their ability to relax properly. They stay constricted. They become stiff. Blood pressure rises. What damages the endothelium? High blood sugar damages it directly. Glucose molecules attach to proteins in a process called glycation, creating advanced glycation end products, or AGEs. These AGEs are toxic to endothelial cells. They impair nitric oxide production. This is why diabetics have such high rates of high blood pressure. Their chronically elevated blood sugar is destroying their endothelial function. Oxidative stress damages the endothelium. Free radicals, unstable molecules missing electrons, attack endothelial cells. They damage the cellular machinery that produces nitric oxide. Where do these free radicals come from? From inflammation, from smoking, from industrial trans fats, from high blood sugar, from lack of antioxidants in the diet. Chronic inflammation damages the endothelium, which leads us to the second root cause: chronic low-grade systemic inflammation. Your body has an inflammatory response that's supposed to be protective. When you get an infection, your immune system creates inflammation to kill the invaders. When you injure yourself, inflammation starts the healing process. This is acute inflammation. It's protective. It's necessary. But chronic inflammation is different. Chronic inflammation is when your inflammatory system stays activated constantly, day after day, month after month, year after year. It's not responding to an infection or an injury. It's responding to modern lifestyle factors that constantly trigger inflammation. And that chronic inflammation damages everything, including your blood vessels. Inflammatory molecules, cytokines like IL-6 and TNF-alpha, circulate constantly in your bloodstream when you have chronic inflammation. They attack your blood vessel walls. They make the endothelium dysfunctional. They promote the formation of atherosclerotic plaques, those cholesterol and calcium deposits that narrow arteries and make them rigid. They make blood vessels stiff and unable to relax. Blood pressure increases. What causes this chronic inflammation? Poor diet is the biggest culprit, specifically excess sugar and refined carbohydrates. When you eat sugar or refined carbs, your blood glucose spikes. That glucose spike causes oxidative stress and inflammation. Do this repeatedly, multiple times per day, every single day, and you create chronic inflammation. Omega-6 fatty acid overload causes inflammation. Industrial seed oils, soybean oil, corn oil, cottonseed oil, these are in virtually every processed food. They're loaded with omega-6 fatty acids. Small amounts are fine. But the modern diet contains 10 to 20 times more omega-6 than omega-3 fats. This ratio promotes inflammation powerfully. Lack of omega-3 fats makes inflammation worse. Omega-3s from fish, walnuts, and flax seeds are anti-inflammatory. They actively reduce inflammation. But most people eating a modern diet get almost no omega-3s. The imbalance drives chronic inflammation. Obesity causes chronic inflammation, especially visceral belly fat. That deep belly fat around your organs isn't just stored energy, it's metabolically active tissue. Fat cells, especially visceral fat cells, secrete inflammatory molecules constantly. The more visceral fat you carry, the more inflammation you create. This inflammation damages your blood vessels and drives blood pressure higher. Lack of sleep causes inflammation. Studies show that even one night of poor sleep increases inflammatory markers measurably. Chronic sleep deprivation, 5 to 6 hours per night or constantly interrupted sleep, creates chronic inflammation throughout your body. Chronic stress creates inflammation. When you're stressed, your body produces cortisol and adrenaline. Short-term, this is fine. Long-term, it creates inflammation. If you're constantly stressed, constantly worried, constantly anxious, you're creating constant inflammation. Gut problems cause inflammation. If you have dysbiosis, an imbalance of bacteria in your intestines, or leaky gut, where your intestinal barrier is compromised, bacterial toxins can leak into your bloodstream. Your immune system responds with inflammation. Chronic gut problems create chronic systemic inflammation. All of this inflammation damages your blood vessel walls. It makes them stiff. It impairs endothelial function and nitric oxide production. Blood pressure rises. And nobody addresses this when they just prescribe blood pressure medications. The third root cause is insulin resistance. This is massive and almost completely ignored in conventional blood pressure treatment. When you eat carbohydrates and sugars, your blood glucose rises. Your pancreas secretes insulin to help glucose enter your cells for energy. This is normal and necessary. But when you eat too many carbohydrates and sugars repeatedly over months and years, your cells become resistant to insulin. They stop responding properly. It's like they've heard the insulin signal so many times they start ignoring it. Glucose can't enter cells efficiently. It stays in your bloodstream. Your pancreas responds by producing even more insulin, trying to force glucose into resistant cells. You end up with both high blood glucose and high insulin levels circulating constantly. This is insulin resistance. It's the core problem in type 2 diabetes. But it develops years before diabetes is diagnosed. You can have severe insulin resistance with normal fasting blood sugar, because your pancreas is compensating by producing massive amounts of insulin. High insulin levels directly raise blood pressure through multiple mechanisms. First, insulin causes sodium retention in your kidneys. Your kidneys normally regulate sodium balance, excreting excess salt. But insulin tells your kidneys to hold on to sodium. When you retain sodium, you retain water along with it. Blood volume increases. More volume means higher pressure. Second, insulin activates your sympathetic nervous system. It increases production of noradrenaline, one of your stress hormones. This causes blood vessel constriction. Constricted vessels mean higher resistance and higher pressure. Third, insulin promotes thickening and stiffening of arterial walls. It stimulates smooth muscle cell growth in vessel walls. Over time, this makes arteries less flexible and more rigid. Rigid arteries can't relax properly. Pressure stays elevated. Fourth, insulin resistance is intimately linked with all the other problems we've discussed. It worsens inflammation. It worsens endothelial dysfunction. It creates oxidative stress. Everything compounds. The vast majority of people with high blood pressure have significant insulin resistance. Their fasting insulin levels are elevated, often dramatically. But doctors almost never check insulin levels. They check fasting glucose, and if it's normal, they assume everything's fine. But you can have completely normal glucose with severely elevated insulin, and that elevated insulin is driving your blood pressure up. The fourth root cause is sympathetic nervous system overactivation. You have two branches of your autonomic nervous system, the part that controls involuntary functions like heart rate and blood pressure. The sympathetic branch is your fight or flight system. It's meant for emergencies. When a tiger is chasing you, your sympathetic system activates. It increases your heart rate. It constricts your blood vessels to shunt blood to your muscles. It raises your blood pressure to perfuse your tissues with oxygen and nutrients. This is protective when you need to run from danger. The parasympathetic branch is rest and digest. It slows your heart rate. It relaxes your blood vessels. It lowers your blood pressure. It promotes healing and recovery. Ideally, you spend most of your time in parasympathetic mode, with brief activations of sympathetic mode when needed. But in modern life, most people are stuck in chronic sympathetic activation. Constant stress from work, from finances, from relationships, from health worries. Constant stimulation from screens and news and social media. High caffeine intake keeping you wired. Poor sleep preventing proper parasympathetic recovery. Your fight or flight system is always on. This keeps your blood vessels constricted constantly. Your heart rate stays elevated. Your blood pressure stays high. And no medication can truly fix this, because pills can't fix your stress response. They can blunt it somewhat, but they can't restore balance to your nervous system. These four mechanisms, endothelial dysfunction, chronic inflammation, insulin resistance, and sympathetic overactivation, are the real causes of high blood pressure in the vast majority of people over 60. They're all connected, they all reinforce each other, and they're all reversible through targeted lifestyle interventions. But you're not told this. You're given pills that force your vessels to dilate, or your kidneys to excrete more fluid. The pills lower the number on the blood pressure cuff, but they don't fix the inflammation. They don't fix the insulin resistance. They don't fix the endothelial dysfunction. They don't fix the stress response. The underlying disease process continues getting worse, which is why you need more and more medications over time. Before I give you the specific strategies to reverse these root causes, I want you to understand something important. I'm not saying medications are bad or unnecessary. Sometimes they're absolutely essential, especially if your blood pressure is severely elevated and you're at immediate risk of stroke or heart attack. Medications can be life-saving in those situations, but medications should be a bridge while you address the root causes. They should be temporary support while you fix what's actually broken. Unfortunately, they've become permanent band-aids that mask symptoms while the disease progresses underneath. Now let me give you the specific strategies that actually work to reverse hypertension by addressing these root causes. But I'm not going to tell you all of them right now. I'm going to tell you about one strategy first, and then we'll build from there. Because understanding how powerful each strategy is will help you appreciate why combining them creates such dramatic results. Strategy number 1 starts with something simple that you probably have in your kitchen right now. something that most people with high blood pressure are severely deficient in. And fixing this one deficiency can drop blood pressure by 10 to 15 points within weeks. Let me tell you about Carol. Carol was 67 years old. Her blood pressure had been creeping up for years. It started in her mid-50s, readings in the 130s over 80s. Her doctor said it was borderline. Keep an eye on it. By her early 60s, it was consistently in the 140s over 85. Her doctor prescribed a low-dose medication. By her mid-60s, despite the medication, her pressure was 155 over 92. Carol had read that salt raises blood pressure. She'd been told to reduce sodium. So she stopped adding salt to her food. She stopped eating obviously salty foods like chips and processed meats and canned soups. She thought she was doing everything right. But her blood pressure barely changed. It dropped maybe 3 or 4 points, still dangerously elevated. When we reviewed her diet in meticulous detail, writing down everything she ate for a full week, the problem became obvious. Yes, she'd reduced her sodium intake somewhat. She was probably consuming around 2,500 milligrams of sodium daily, instead of the 3,500 to 4,000 she'd been eating before. That was good. But there was a much bigger problem. Her potassium intake was abysmal. Looking at her food diary, she was eating very few vegetables, maybe 2 small servings per day. Almost no leafy greens, no spinach, no kale, no Swiss chard, no avocados, rarely any bananas, no sweet potatoes, minimal beans or legumes. Her potassium intake was probably 1,500 to 1,800 milligrams daily. The recommended potassium intake is 3,500 to 4,700 milligrams per day. Carol was getting barely 1/3 of what her body needed. And this deficiency was directly causing her elevated blood pressure. Here's why this matters so much. Sodium and potassium work in opposition to regulate blood pressure. They're like a balance scale. Sodium causes water retention and blood vessel constriction. Potassium promotes sodium excretion through your kidneys and helps blood vessels relax. Your body needs a proper balance between these two minerals. The ideal sodium to potassium ratio is about 1 to 2 or even 1 to 3. For every milligram of sodium you consume, you should be getting 2 to 3 milligrams of potassium. But most people eating a modern diet have the ratio completely backwards. They're getting 2 to 1 or 3 to 1, way too much sodium relative to potassium. And this imbalance drives blood pressure higher. When you consume sodium without adequate potassium, your kidneys can't excrete the excess sodium efficiently. It accumulates. You retain water along with it. Blood volume increases. Blood pressure rises. Additionally, low potassium causes your blood vessels to stay constricted. They can't relax properly. Resistance stays high. Pressure stays high. Potassium is absolutely essential for proper blood vessel function. It works at the cellular level, in the smooth muscle cells that line your arteries. These cells have special channels in their membranes called potassium channels. When potassium flows through these channels, it causes the muscle cells to relax. Blood vessels dilate. Resistance drops. Pressure falls. When potassium is deficient, these channels don't work properly. The muscle cells stay contracted. Blood vessels stay constricted. No amount of sodium restriction can fully compensate for potassium deficiency. I told Carol to stop focusing so much on restricting sodium and instead flood her body with potassium-rich foods. Eat massive amounts of vegetables, especially leafy greens like spinach, kale, and Swiss chard. Every lunch and dinner should have at least 2 to 3 cups of cooked or raw vegetables. Include avocados daily. They're one of the most potassium-rich foods available, with about 700 to 900 milligrams per avocado. Eat potassium-rich foods like sweet potatoes with skin, white potatoes with skin, bananas, cantaloupe, oranges, tomatoes, and beans. Carol committed to this. She made vegetables the foundation of every meal. Huge salads with lunch, sautéed greens with dinner, sweet potatoes as snacks, avocado on everything, beans added to meals. Within 2 weeks, her blood pressure had dropped from 155 over 92 to 142 over 85. Still elevated, but noticeably better. Within 6 weeks, it was 128 over 78. Within 3 months, her average blood pressure was 124 over 76. She hadn't changed her medication. She hadn't changed anything else about her diet or lifestyle. She'd just dramatically increased her potassium intake. That single change had dropped her blood pressure by 31 points systolic and 16 points diastolic. The potassium helped her kidneys excrete excess sodium naturally and efficiently. It helped her blood vessels relax. It corrected the fundamental imbalance that had been driving her hypertension for years, a deficiency nobody had identified or addressed. But I'm not going to tell you exactly how much potassium to eat yet. I'm not going to give you the complete list of foods yet, because there's another critical mineral deficiency that works hand in hand with potassium deficiency, and you need to understand that first. Comment below if you've been told to reduce sodium, but nobody ever mentioned increasing potassium. Type sodium only if your doctor focused only on salt restriction without addressing potassium. Let me know how many people are making this critical mistake. Before we continue with the other essential strategies, including one that addresses the inflammation directly and one that fixes insulin resistance, I want to make a request. If what you've heard so far seems valuable, if you're learning things about the root causes of high blood pressure that you've never heard before, I'm asking for 2 actions. First, consider subscribing to this channel if you haven't already. My mission is to provide evidence-based health information that addresses root causes, not just symptoms. Information that could genuinely reverse disease, not just manage it. Information your doctor often doesn't have time to explain in brief appointments. Second, please share this video. Think about your friends, your family members, anyone struggling with high blood pressure and taking multiple medications without understanding why their pressure is elevated in the first place. How many people could benefit from understanding these root causes? A simple share could start a conversation that transforms someone's health. And if you want even more detailed information, I've created something special for this community. I'm working on a comprehensive ebook about reversing hypertension, protecting your heart, and preventing stroke. It will contain everything I wish I could tell every patient: the complete protocols, specific meal plans, supplement guidance, exercise programs, everything. If you want to be notified when it's ready and receive exclusive health information I can't fit into videos, join my free newsletter. The link is in the description below. No spam, just valuable information delivered to you. Updates on research, answers to common questions, practical tips you can implement immediately. Thank you. Now let's continue with the next critical strategy. This one addresses another epidemic deficiency that's directly causing elevated blood pressure in millions of people. The second strategy involves magnesium. Magnesium deficiency is one of the most overlooked causes of high blood pressure, and studies suggest up to 50% of people with hypertension are deficient in magnesium. Magnesium is nature's calcium channel blocker. It relaxes smooth muscle in blood vessel walls. It improves endothelial function. It reduces inflammation. Without adequate magnesium, your vessels stay constricted and stiff. Let me tell you about Richard. Richard was 71 years old when he came to see me. He had what doctors call resistant hypertension. That means his blood pressure stayed elevated despite being on multiple medications. Richard was taking 4 different blood pressure medications, 4 pills every single morning, an ACE inhibitor, a calcium channel blocker, a diuretic, and a beta blocker. Maximum doses of all of them. And his blood pressure averaged 158/94. Still dangerously high, despite 4 medications. His doctors were running out of options. They'd tried different combinations, different doses. Nothing brought his pressure down adequately. They were considering adding a 5th medication, something even more aggressive. But Richard had other symptoms that nobody was connecting to his blood pressure problem. He had terrible leg cramps at night. Nearly every night, he'd wake up with excruciating cramps in his calves. The muscles would contract so hard they felt like they were tearing. The pain was unbearable. He'd have to get out of bed, walk around, stretch, massage the cramping muscles until finally they released. By then, he was fully awake and had trouble getting back to sleep. He had heart palpitations, random episodes where his heart would suddenly start racing or skipping beats. It was frightening. He'd had cardiac workups, EKGs, echocardiograms, even a stress test. Everything came back normal. His cardiologist said it was benign, probably just stress. But it kept happening. He was chronically constipated. He'd go 3 or 4 days without a bowel movement. When he finally did go, it was difficult and uncomfortable. He'd tried fiber supplements. He'd tried drinking more water. Nothing seemed to help consistently. And he was exhausted all the time. Just a pervasive fatigue that never went away. He'd sleep 7 or 8 hours and wake up tired. Everything required enormous effort. Nobody connected these symptoms. His doctors treated them as separate problems. The leg cramps were just age. The palpitations were benign. The constipation got him a prescription for a laxative. The fatigue was attributed to his blood pressure medications, or maybe depression. But these symptoms, all of them, every single one, are classic signs of magnesium deficiency. And I suspected that was exactly what Richard had. We tested his magnesium levels. Standard serum magnesium was 2.0 milligrams per deciliter. The reference range is 1.7 to 2.2. So, by standard measures, his magnesium was normal. Low end of normal, but still technically within range. Many doctors would stop there and say magnesium isn't the problem. But serum magnesium is a terrible indicator of actual magnesium status. Only 1% of your body's magnesium is in your bloodstream. The other 99% is inside cells, in bones, in tissues. Your body will maintain serum magnesium in normal range by pulling it from your tissues even when you're severely deficient overall. Serum magnesium can look fine while you're actually depleted. The better test is red blood cell magnesium. This measures the magnesium content inside your red blood cells, which reflects tissue stores much more accurately. We ran that test. Richard's RBC magnesium was 4.2 milligrams per deciliter. Normal range is 4.8 to 6.5. He was clearly deficient. I started Richard on magnesium supplementation immediately. 400 milligrams of magnesium glycinate daily, split into 2 doses. 200 milligrams in the morning and 200 at night. Magnesium glycinate is one of the best absorbed forms and doesn't cause the digestive upset that cheap magnesium oxide often does. I also worked with him to dramatically increase magnesium-rich foods in his diet. Leafy green vegetables are loaded with magnesium. Every molecule of chlorophyll, the green pigment in plants, has a magnesium atom at its center. Eating greens is eating magnesium. Pumpkin seeds, almonds, cashews, black beans, avocados, and dark chocolate with at least 70% cacao are all excellent magnesium sources. Within 3 weeks, Richard's symptoms started changing. The leg cramps stopped. Completely. He was sleeping through the night without those agonizing cramps waking him up. His heart palpitations decreased dramatically. They didn't disappear entirely, but instead of multiple episodes per week, he might have one mild episode every 2 weeks. His bowel movements normalized. Daily, comfortable, easy. And his energy improved noticeably. He wasn't exhausted constantly anymore, and his blood pressure started dropping. Within 8 weeks of magnesium supplementation and dietary changes, his average blood pressure was 136/82. Still not perfect, but a dramatic improvement from 158/94. For the first time in years, his pressure was below 140 systolic. His doctor was able to reduce one of his 4 medications. Instead of maximum doses of 4 drugs, he went down to 3 drugs. It wasn't a complete reversal, but it was significant progress. And just as importantly, Richard felt better than he had in years. Why is magnesium deficiency so common? Multiple factors contribute. Modern agricultural practices have depleted magnesium from soil. Crops grown in magnesium-depleted soil contain less magnesium than the same crops grown 50 years ago. Processed foods contain almost no magnesium. The refining process strips it out. When whole wheat is processed into white flour, 80% of the magnesium is lost. When brown rice becomes white rice, most of the magnesium disappears. Stress depletes magnesium rapidly. Every time you experience stress, your body uses magnesium to help respond. Chronic stress creates chronic magnesium drain. Certain medications interfere with magnesium absorption, particularly proton pump inhibitors for acid reflux. These drugs reduce stomach acid, and you need adequate stomach acid to absorb magnesium efficiently. Older adults absorb magnesium less efficiently than younger people. Even if you're eating adequate magnesium, you might not be absorbing it well. And most people aren't eating anywhere near adequate amounts to begin with. Studies suggest average magnesium intake is around 250 milligrams daily, when optimal intake is 400 to 500 milligrams for men and 310 to 420 milligrams for women. Magnesium works to lower blood pressure through multiple mechanisms. It acts as a natural calcium channel blocker. Your blood vessels constrict when calcium flows into smooth muscle cells. Magnesium blocks calcium channels, preventing excessive calcium entry. This allows vessels to stay relaxed. Magnesium improves endothelial function and nitric oxide production. Remember, nitric oxide is your natural blood pressure regulator that makes vessels dilate. Adequate magnesium is essential for endothelial cells to produce optimal nitric oxide. Magnesium reduces inflammation. It helps regulate inflammatory cytokines and reduces oxidative stress. Less inflammation means healthier, more flexible blood vessels. Magnesium improves insulin sensitivity. It's required for insulin to work properly. Magnesium deficiency worsens insulin resistance, which, as we discussed, raises blood pressure through multiple pathways. Correcting magnesium deficiency improves insulin function. Studies have proven magnesium's blood pressure-lowering effects. A meta-analysis of 22 clinical trials found that magnesium supplementation lowered systolic pressure by an average of 3 to 4 points, and diastolic by 2 to 3 points. That might not sound dramatic, but in people who are magnesium deficient, the effects are much larger. Individual studies in magnesium-deficient people show reductions of 10 to 15 points or more. But I'm still not going to tell you the exact supplementation protocol yet. I'm still not going to give you the complete strategy, because there's something even more powerful that needs to be addressed first. Something that's driving inflammation, insulin resistance, and blood pressure elevation in the majority of people over 60. Comment if you think you might be magnesium deficient. Type low magnesium if you have leg cramps, palpitations, constipation, or fatigue. These are telltale signs that millions of people ignore. The third strategy involves losing a specific type of fat, not just any body fat, specifically visceral belly fat, that deep fat around your organs that you can't pinch. This isn't about appearance or vanity. This is about the fact that visceral fat is metabolically active, secreting inflammatory molecules and hormones that directly raise blood pressure. Let me tell you about David. David was 69 years old. He wasn't hugely overweight. His BMI was in the overweight range, but not obese. Looking at him clothed, he looked fairly normal. Maybe a bit of a belly, but nothing extreme. But David carried almost all his weight in his midsection. His arms were thin, his legs were thin. All his excess weight was concentrated in his abdomen. When we measured his waist circumference, it was 44 inches. His hips measured 38 inches. That gave him a waist-to-hip ratio of 1.16. Anything over 0.90 for men indicates dangerous levels of visceral fat. David was way over. His blood pressure was 168/96. He was on 2 blood pressure medications, an ACE inhibitor and a diuretic. Despite the medications, his pressure stayed dangerously elevated. His doctor kept increasing doses and suggesting additional medications. David's visceral fat was actively working against his blood pressure control. Visceral fat cells don't just store energy, they're endocrine organs. They secrete hormones and inflammatory molecules constantly. They produce inflammatory cytokines like IL-6, TNF-alpha, and others. These circulate in your bloodstream, creating chronic systemic inflammation. That inflammation damages blood vessel walls, impairs endothelial function, reduces nitric oxide production. Blood pressure rises. They produce hormones that affect sodium balance and blood vessel constriction. They interfere with insulin signaling, promoting insulin resistance. As we've discussed, insulin resistance drives blood pressure higher through multiple mechanisms. They produce a substance called angiotensinogen. Your body converts this into angiotensin II, one of the most powerful blood vessel constrictors known. The more visceral fat you carry, the more angiotensinogen you produce. The more angiotensin II you create, the more your blood vessels constrict, the higher your blood pressure rises. David's belly fat was like a factory producing blood pressure-raising substances 24 hours a day. No medication could fully overcome that constant biochemical assault. We focused on reducing David's visceral fat specifically through a targeted approach. First, We drastically reduced refined carbohydrates and all added sugars from his diet. These are the primary drivers of visceral fat accumulation. Every time you eat refined carbs or sugar, your blood glucose spikes. Your pancreas releases insulin. Insulin promotes fat storage, and it preferentially directs fat into visceral compartments when it's chronically elevated. Second, we significantly increased his protein intake, from about 60 grams daily to 100 to 120 grams daily. Higher protein intake preserves muscle mass during weight loss. Muscle is metabolically active and helps regulate blood sugar and insulin. Losing muscle makes everything worse. We needed David to lose fat while maintaining or even building muscle. Third, we added resistance training. Twice per week, simple bodyweight and dumbbell exercises, squats, lunges, rows, presses. Building muscle directly improves insulin sensitivity and glucose metabolism. It also sends signals that tell your body to preferentially burn visceral fat. Fourth, we implemented a 16-8 intermittent fasting schedule. David would eat all his food within an 8-hour window, from noon to 8 p.m., then fast for 16 hours until noon the next day. During the fasting period, insulin levels drop to baseline. Fat burning increases, and research shows that intermittent fasting specifically targets visceral fat for oxidation. The combination was powerful. David wasn't suffering or starving. He was eating satisfying meals within his eating window. High protein, lots of vegetables, healthy fats, moderate carbs from whole food sources only. No refined carbs, no added sugars, no processed foods. Over 6 months, David lost 28 pounds. His total weight went from 218 to 190. But more importantly, the composition of that weight loss was almost entirely fat, especially visceral fat. His waist circumference dropped from 44 inches to 37 inches, 7 inches off his belly. His waist-to-hip ratio went from 1.16 to 0.97, still not optimal but dramatically improved. And his blood pressure transformed. It dropped from 168/96 to 128/78. His doctor was stunned. They eliminated one of his 2 medications entirely. The remaining medication was reduced to half the previous dose. David's blood pressure was better controlled on less medication than it had been on more. Studies confirm this. Every 10 pounds of weight loss typically reduces blood pressure by 5 to 10 points. But when that weight loss is specifically from visceral fat, the effect is even stronger. Losing visceral fat reduces inflammation dramatically. It improves insulin sensitivity. It reduces production of angiotensinogen and other blood pressure-raising substances. Everything improves when visceral fat melts away. But I'm not going to tell you the complete nutrition protocol yet. I'm not going to give you the exact meal plan or fasting schedule, because there are 3 more strategies that are equally critical, and combining all of them creates synergistic effects far beyond what any single intervention achieves. Comment below if you carry most of your weight in your belly. Type belly fat if your waist circumference is over 40 inches for men or 35 inches for women. Let me know how many people have this dangerous fat pattern. The 4th strategy is something you probably already know you should do, but might not realize is as powerful for blood pressure as it actually is. Exercise. Specifically, regular, moderate-intensity cardiovascular exercise done consistently. This addresses multiple root causes simultaneously. Let me tell you about Helen. Helen was 73 years old with blood pressure averaging 162/88. She was on 2 medications. Her doctor wanted to add a 3rd. Helen hated taking pills. She asked me if there was anything else she could do. I told her about the research on exercise and blood pressure. I explained that moderate-intensity aerobic exercise, walking briskly, cycling, swimming, anything that elevates your heart rate to 50 to 70% of maximum for 30 to 60 minutes, done at least 5 days per week, has been proven to lower blood pressure as effectively as many medications. Helen committed. She started walking every morning, 40 minutes at a pace where she could talk but not sing. That's the right intensity, brisk enough to challenge you, but not so hard you're gasping. She did this religiously, 5 to 6 days per week, every single week. She didn't change her diet initially. She didn't change her medications, just added the walking. After 4 weeks, her blood pressure had dropped to 148/82. After 12 weeks, 132/76. After 6 months of consistent walking, her average pressure was 126/74. Her doctor eliminated one medication entirely and reduced the dose of the remaining one. Exercise lowers blood pressure through every mechanism we've discussed. It improves endothelial function dramatically. During exercise, increased blood flow creates shear stress on the endothelium. This shear stress stimulates production of nitric oxide. Regular exercise trains your endothelium to produce more nitric oxide continuously, even at rest. More nitric oxide means better vessel relaxation and lower pressure. Exercise reduces inflammation powerfully. Physical activity triggers anti-inflammatory responses. It increases production of anti-inflammatory molecules. It reduces inflammatory markers like C-reactive protein. Less inflammation means healthier blood vessels. Exercise improves insulin sensitivity dramatically. When muscles contract, they take up glucose without requiring as much insulin. Over time, regular exercise makes cells more responsive to insulin. Lower insulin means lower blood pressure through all the mechanisms we discussed. Exercise helps you lose weight, particularly visceral fat. It preserves and builds muscle mass. It activates parasympathetic nervous system during recovery periods, helping balance out sympathetic overactivation. The research is overwhelming. Studies show moderate-intensity aerobic exercise reduces blood pressure by an average of 5 to 8 points systolic and 3 to 5 points diastolic. But in people who were previously sedentary, the effects are often larger. Meta-analyses of clinical trials consistently show that exercise is as effective as many first-line blood pressure medications. But I'm still withholding the complete protocol. Because there's one more lifestyle factor that's absolutely critical, and most people with high blood pressure are failing miserably at it. The fifth strategy is sleep. Quality sleep of adequate duration. This is massively underrated and almost never addressed in blood pressure treatment. But poor sleep is one of the strongest risk factors for developing hypertension and one of the biggest obstacles to reversing it. Kenneth was 68. His blood pressure was always higher in the morning than evening. Morning readings would be 172/94. By evening, they'd be 142/82. His doctor kept increasing morning medication doses, but nothing worked well. When I asked about sleep, everything became clear. Kenneth slept only 5 to 6 hours per night. He woke up 3 to 4 times nightly to urinate. He snored heavily. He woke up exhausted. We tested him for sleep apnea. He had moderate obstructive sleep apnea, stopping breathing 22 times per hour. We got him on CPAP therapy. We addressed his nocturia. We implemented sleep hygiene practices. Within 3 weeks of starting CPAP, Kenneth's morning blood pressure dropped from 172/94 to 148/84. Within 2 months, with consistent CPAP use and 7 to 8 hours of quality sleep, his morning readings were 132/78. Poor sleep activates your sympathetic nervous system, keeping you in fight or flight mode. It impairs endothelial function. It increases inflammation. It worsens insulin resistance. Everything we've discussed gets worse with poor sleep. Studies show people sleeping less than 6 hours per night have significantly higher hypertension rates. Improving sleep from 5 to 6 hours up to 7 to 8 hours can lower blood pressure 10 to 15 points. The sixth strategy addresses stress and nervous system balance. You can't eliminate stress, but you can train your body to respond differently. Practices that activate parasympathetic nervous system are extraordinarily powerful. Barbara was 70, caring for her husband with dementia. Blood pressure, 176/92, despite 3 medications. The stress was killing her. I taught her resonant frequency breathing, 6 breaths per minute, inhale 5 seconds, exhale 5 seconds, 10 to 20 minutes daily. This breathing pattern powerfully activates parasympathetic nervous system. Within 2 weeks, her pressure dropped to 158/86. Within 6 weeks, 138/80. Her doctor reduced one medication. The breathing didn't eliminate her stress, but it changed how her body responded. Meditation, yoga, tai chi, nature walks all activate parasympathetic tone. Studies show regular meditation lowers pressure 8 to 10 points. Yoga consistently lowers pressure 10 to 15 points. These aren't luxuries. These are medical interventions. And now, the seventh and most powerful strategy: the dietary pattern that addresses every root cause simultaneously. A whole food, plant-predominant diet like DASH or Mediterranean diet. William was 66. Blood pressure 170/96, despite 2 medications. He ate standard American diet: processed foods, fast food, minimal vegetables, refined carbs, industrial oils. I challenged him to follow DASH diet strictly for 3 months. Massive vegetables every meal. Fruits for snacks. Beans and lentils regularly. Fish and chicken instead of red meat. Nuts and seeds. Olive oil. Whole grains. No processed foods. Results were dramatic. Within 2 weeks, pressure was 152/88. Within 6 weeks, 136/80. After 3 months, 124/76. His doctor eliminated 1 medication, cut the other in half. Why is this so powerful? It's rich in potassium from vegetables and fruits, rich in magnesium from greens, nuts, seeds, anti-inflammatory from antioxidants and polyphenols, improves insulin sensitivity by emphasizing whole foods and fiber, improves endothelial function from nitrates in greens converting to nitric oxide, promotes weight loss naturally from high fiber and low calorie density. The original DASH study showed blood pressure reductions averaging 11 points systolic and 5 points diastolic. In people with hypertension, reductions were even greater. Mediterranean diet shows similar benefits. The practical application: build meals around vegetables. Half your plate non-starchy vegetables at lunch and dinner. Fruit with breakfast or snacks. Whole grains over refined. Beans several times weekly. Fatty fish twice weekly. Olive oil as primary fat. Nuts daily. Minimize processed foods, sugary drinks, excessive alcohol. Now you have all 7 strategies. Optimize sodium-potassium balance. Correct magnesium deficiency. Lose visceral belly fat. Regular cardiovascular exercise. Improve sleep quality. Manage stress. Follow whole food, plant-predominant diet. These aren't quick fixes. They require commitment. But unlike medications that just mask symptoms while disease progresses, these interventions fix what's broken. They improve endothelial function, reduce inflammation, improve insulin sensitivity, balance nervous system, address root causes. My message isn't to stop medications without supervision. These strategies work best alongside appropriate medical treatment initially. My message is empowerment. You have evidence-based tools to reverse the underlying disease, not just control the number. Implement these systematically. Start with 1 or 2. Master them. Add more. Monitor blood pressure at home. Work with your doctor. As your pressure improves, you'll need medication adjustments. This is something to celebrate, but must be done safely under medical supervision. Share your experience in comments. Which strategy will you start with? Have you tried any with success? What's your biggest obstacle? Your stories help others struggling with the same issues. If you haven't already, join my free newsletter. Link in description. I share detailed health information, research updates about blood pressure and cardiovascular health, and answer viewer questions. You'll be first to know when my comprehensive hypertension reversal ebook is released. Complete guide with meal plans, exercise protocols, supplement guidance, medication information, monitoring strategies, everything. That first step today, implementing even one strategy, could begin reversing your hypertension. The difference between needing more medications or fewer, between suffering stroke or preventing it, between exhaustion or energy, between dependence on medical system or independence through health. The power is in your daily choices. Final reminder, this information is for educational purposes only. I am not your doctor. Always consult with your personal physician before making any changes to blood pressure medications or treatment plan. Never stop blood pressure medication abruptly without medical supervision, as this can be dangerous. What I've shared may not apply to your specific situation. Only your doctor, who knows your complete medical history, can give personalized medical advice. Hypertension management must be individualized based on your unique circumstances. Take care of yourself. Monitor blood pressure at home regularly. Implement these strategies carefully and systematically with your doctor's guidance. I'll see you in the next video, where we'll continue this mission of taking control of your cardiovascular health together.